Okay, alright. So we're done now with how many parameters? Parang ano pa? Tatlo, Diyos ko. Okay, alright. So we'll now go to the fourth parameter, which is, of course, your specific gravity. So specific gravity, di ba, na-discuss na natin is sa physical exam. And specific gravity is, again, the comparison of the density of a solution to the density of distilled water. Okay, now, ato na po siyang gamit sa chemical exam because, again, in a way, it detects, again, the ability of the kidneys to concentrate the glomerular filtrate. Okay? By selectively, again, reabsorbing essential chemicals and water from the glomerular filtrate. Again, normal na itong spec grav sa urine specimen is about 1.015 to 1.030. But again, this would depend on the body state of hydration and other factors. Therefore, pwede siyang go as low again as low as 1.002 to as high as 1.035. Now again, walay urine spec grav na 1.000 ha, that's distilled water na. And wala po nag-iihi na distilled water, no? Okay. All right, so that's normal spec grav. And yeah, okay. So again, that's the point of specific gravity. Basically, you detect if ang kidneys kabalo ba siya mupili sa mga dapat na i-retain o katong ma-release o ma-concentrate ba dyan niya itong mga naa sa glomerulus na filtrate. Okay, that's the point of your specific gravity. Now, for clinical significance, of course, you want to monitor patients' hydration and dehydration. Of course, because again, your spec grav is quite influenced by the body's state of hydration. So, if your patient is well hydrated, then therefore your spec grav is quite low, diba? And if dehydrated, medyo concentrated yung specimen, therefore it's quite high, okay? Next is loss of renal tubular concentrating ability. So, in terms of kanang pag-reabsorb or pag-secrete ba sa mga substances. Diabetes insipidus, yes naman, because again of decreased production of vasopressin or ADH. Therefore, magsige rag-release og water. In a way, madilute ang specimen. Therefore, low ang imuhang spec grav. And of course, unsatisfactory specimens due to low concentration. Because again, parehas ganina, katong spec grav na 1.000 daw sa akong co-intern, di kasabaan siya sa iyang RMT sa clean mic. Kaya like ana siya, unsa man distilled water? Again, wala urine na ang spec grav is 1.000. Okay? Alright, so muna siya, dira na siya mo factor in. Unsatisfactory specimens due to low concentration. Especially sa mga drug testing in a way na specimens or kanang mga kailangan o quantitative na mga results sa urine. Okay? Alright, that's for spec grav. Okay. Now, in terms of principle, it's your pKa change of a polyelectrolyte. pKa, di ba, in your biochem, the dissociation constant of a weak acid, right? And in an alkaline medium. Now, what happens is, so here's an example of the polyelectrolyte sa reagent strip. So, mo depend siya on the number of the solutes or ions present in the urine. Alright, now if gamay rang ions, gamay ra pod na H iyahang i-dissociate. Therefore, gamay ra man ang H sa imuhang solution, therefore, unsa ang pH? Alkaline. Therefore, that will result to a blue-green alkaline pH. And whereas kung daghan kaayo ang solutes or ions na naa, mo release mo siya equal amounts of H+. Therefore, daghan mang H+, therefore it's acidic. Hence, you have a yellow-green acid pH. So, dira na siya dira na ang results sa imuhang spec grav. Again, the more dissolved ionic solutes are present, the more polyelectrolytes release H+ ion. So meaning, if mas daghan imong ionic solutes na, mas daghang H+ i-release ang imuhang polyelectrolyte. Hence, causing the reaction or causing the result to be acidic. Therefore, ang reagents nimo manggod are methyl vinyl ether malic anhydride and bromthymol blue, which are again pH indicators, diba? And yeah, bromthymol blue, that's for spec grav. Again, if gamay ra ang solutes na naa, gamay ra po na H+ ang i-release sa polyelectrolyte. Hence, alkaline lang ang pH, therefore ang color sa imong reaction is blue to green. Now, if daghan ang solutes naa sa ihi, daghang H+ na ions i-release ang polyelectrolyte. Therefore, mahimong acidic ang pH, mahimong acidic ang solution. Therefore, ang color sa imuhang strip is, or sa imuhang pad is yellow-green. Okay. Alright, so these are color changes again. Your colors are again from blue through shades of green to yellow. So, as you can see, diba, blue or alkaline, medyo darker, di ba? Green, ana. And pagka-acidic na, minidaghan ng solutes, ang naa sa ihi, daghang H plus na ang gidli sa polyelectrolyte, mas magka-lighter siya or yellow na. Alright? Okay. Okay, so interference for false positive, because of protein and ions, high concentration, therefore, mas daghang solutes na naa, then, of course, dili na siya, mas daghang H plus i-release ang polyelectrolyte. Okay, therefore, mas false positive. Now, di naman ta mag-correct sa reagent strips because, again, the reagent strip na reaction, they detect ionic solutes. Dili ito mga glucose, which are not ionic solutes, di ba? Example lang ang mga protein and ions na ma-dissociate. So, ma-detect siya, alright? But for glucose, mga other dagko na molecules, dili na siya ma-detect sa specgraph. Munang, dili siya, di na kailangan ng correction. Okay? Alright. So, that's for false positive. So, dili na maka-interfere usually ng mga dagko kayo na glucose, and alright? Okay. And next, for false negative, urine with pH greater than 6.5, mo-affect siya sa bronchthymol blue. That's why your manufacturers, when the pH daw is at 6.5, greater than 6.5, muad na kaog plus 0.005 sa imong SG na reading. If ang imuhang pH daw is greater than 6.5. Kaya since mo-affect na siya sa bronchthymol blue, muad na daw kag plus 0.005 sa imong SG na reading sa strip. Okay? Alright. Kung ang pH again is greater than 6.5. That's for specific gravity. Okay, next we go now to blood. Ayan, for blood, again, this is the fifth na ba? Oh, fifth pa. Okay. So, blood in urine, it can be in three forms. Again, one is hematuria. Hematuria meaning the presence of RBCs, intact RBCs sa imong urine. It could be hemoglobinuria, again, because of the presence of hemoglobin. And of course, myoglobinuria, the presence of myoglobin. As you can see, di ba, mas gamay gyud siya nas molecule compared to hemoglobin, right? So, it's rapidly cleared by the body. Okay? Alright. Ayan. So for clinical significance, again, for hematuria, renal calculi, or kidney stones, one of the major presenting symptoms of renal calculi or kidney stones is hematuria, okay? May it be kanang makit-an jud or sa microscopic. Now, usually if ang patient daw mo present og symptom with back pain, okay? Mo request gyud na og back pain and then pain during urination, mo request yun daw nag-urinalysis. And if ang urinalysis results man gani, makita na RBCs, then that could be due to renal calculi or kidney stones. Okay? Glomerulonephritis or, inflammation sa imong glomerulus may be due to some bacteria or other mga substances which can lead to the destruction of glomerulus, hence resulting to the release of blood. Okay? You also have pyelonephritis. Pyelonephritis is bacterial inflammation of your kidney tubules. Okay? So, may bacteria na nakaabot dito. So, again, pwedeng damage on tubules which can release bloods. Tumors, of course. Trauma, of course, na trauma siya. So, may be a blunt trauma or naigo og intense. Alright? Ang imuhang kidneys or ang tubules magani, which can result to damage sa tubules pa rin. Exposure to toxic chemicals still, example, myoglobin, that's toxic to your tubules. Hemoglobin also, alright? Anticoagulants, again, still the same. Pwede siyang maka-promote og bleeding, therefore. Kaya dili man nimo ang coagulation. Dili siya maka-paano og coagulation. Therefore, ma-promote siya sigig bleeding, okay? So, that means, in a way, magpadano siya po ng bleeding. So, hence, na hematuria. And strenuous exercise because of, again, due to sa mga wear and tear sa imong muscles or could be because of too much na pag-exercise, medyo imong mga kidney, imong tubules or imong mga blood vessels, which can result to the presence of RBCs na. Okay? Alright. And hemoglobinuria, transfusion reactions, especially if sayop na blood type, what happens is, if sayop ang blood type manggod, your body counteracts the RBCs, nag-donate, so manglies ang RBCs, therefore, mo release ang hemoglobin, transfusion reactions. You'll have this in blood bank and immunosero sa second sem. Hemolytic anemias, your anemias that your RBCs are mukulitag erupt. Those are example of hemolytic anemias. Severe burns, these can cause due to mga fluid loss, and aside from that, also mga tissue damage, okay, which can result to the hemolysis of RBCs. Okay? Next, you have infections and malaria. Of course, malaria, you're all well known na hemolytic na siya, di ba? Black water fever, kinsay nakakos ana? Oh my gosh. Black water fever, you have Plasmodium falciparum because of, again, of excessive lysis of RBCs. Okay? All right. Strenuous exercise, red blood cell trauma, spider bites, which I believe can cause the hemolysis of RBCs. And yeah, That's for hemoglobinuria. Now, for myoglobinuria, by the name itself, myoglobin, it's always found in the muscles. Therefore, ang mga diseases na associated to myoglobinuria are those that are diseases na na-problem sa muscles. So, example, muscle trauma and crush syndromes, prolonged coma because sige ra kang gahigda. So your muscles tend to waste, meaning magka-deteriorate na siya. Therefore, ma-release siya myoglobin. Okay? Convulsions, muscle wasting, again, diseases, alcoholism or overdose, still because of muscle deterioration, and drug or heroin abuse, extensive exertion, and this one, guys, cholesterol-lowering statin medications. So in your clean chem siguro, i-mention ni Sir Alex, usually ang usa sa mga tambal sa cholesterol-lowering are your mga statin. So example of statin, ang both you're familiar, mga simvastatin, yes, lovastatin, yan na. So simvastatin, okay. Now, iyaha daw side effect is rhabdomyolysis. Now, rhabdomyolysis, again, the destruction of your muscles. So therefore, rhabdomyolysis promotes, again, the release of myoglobin to the environment. Okay? So again, rhabdomyolysis din daw sa mga hazing na patients, usually, mo daw na ilang makamatchan because of excessive myoglobin production and because of excessive rhabdomyolysis. Okay? Sa hazing daw ng mga patients. Okay, rhabdomyolysis. Rhabdomyolysis. The destruction of mga muscles. Okay? Alright, now for blood, ang principle niya is your pseudoperoxidase activity. Pseudoperoxidase activity of hemoglobin. Meaning, anong pseudo? Because it's not really true, pero medyo true na siya. Like, it's not, you know, hemoglobin is not an enzyme. Okay? It's a protein, but it has an enzyme activity. Like, muna siya, pseudoperoxidase. It has a peroxidase-like activity, ang hemoglobin. And that's what we use. So your H2O2 and chromogen, what happens is ang hemoglobin, ang heme, iyang i-oxidize ang chromogen. Okay? So iyang i-oxidize ang chromogen together with H2O2. Now, in the process of peroxidase, i-convert na ang everything into an oxidized chromogen and H2O. And this oxidized chromogen is what we detect sa tuang pads. Okay? So therefore, the more ang hemoglobin, mas daghang chromogen ang ma-convert. Okay? Not only hemoglobin also, but myoglobin. Alright? Okay. And your chromogen is tetramethylbenzidine. How do I remember it? Tetramethylbenzidine, tetramethylbenzidine. Basta ganin na tetramethylbenzidine, then that's probably blood. Okay? Okay, or yeah. Yeah, I think muna ako pag-remember. Or I think dihydro, blood yan. Okay, alright. Okay. Now for color changes, as you can see, yellow through green to speckled. Now, anong speckled? It's because non-hemolyzed. When we say non-hemolyzed, nandiyan po intact RBCs. Now, when these RBCs pass sa pad, mahitabo is muhimolay sa sala dito. Alright? So, what happens na yung mga speckled patterns? It would depend na on the number of RBCs. Alright? So, as you can see, if mas daghan ng RBCs, mas daghan po ng speckled pattern. Okay? Muna siya yung point sa speckled because the RBCs are intact. Pag pass nila sa pad, dito pa sila ni erupt or ni lyse. Okay? Alright, that's for blood. Okay. Now, some interferences, false positive, again, oxidizing agents. Unsa may principle ba? Peroxidase, oxidase. So example, mga bleach, i-intensify niya ang action sa peroxidase activity sa hemoglobin or sa peroxidase na enzyme, therefore, maka-false positive siya. Next, you have bacterial peroxidases, still, same na principle sa oxidizing agents. Menstrual contamination, therefore, if gimens good ang patient, usually, dili siya advisable na magpa-UA. But, if kailangan na good siya, then, we usually, ang buhaton sa lab is i-process ang ihi, but i-make sure na i-note sa results na the patient is having her menstrual period at this time of collection or processing. Inana. Para ma-aware ang doctor na ang blood na pwedeng makita sa ihi, it's probably not due to a disease in the kidneys or unsa ba. Maybe it's because of menstrual. But again, ideally, dapat dili siya kuwaan o ihi if gimens. Alright. Now, false negative, high-spec graft or crenated cells. Why? Because ang crenated cells, dili na siya ma-detect sa imuhang crenated, meaning ni shrink ra ang cells. Wala siya ni erupt yun. Alright? So, high-spec graft, decrease na ang sensitivity. Dili na siya ma-detect sa imuhang, the enzymes that we use. Formalin, I think it affects also the enzymes, yeah. Captopril, which is a high blood, hypertensive medication, still, same reason, maka-affect siya sa imuhang mga the reagents that we use, and high nitrites greater than 10 mg per DL. As you can see, murag nabalik na ning high nitrite, I think sa bilirubin. So we'll have a summary na lang ana kung kinsay mo affect ang nitrite, kinsay ang maapektuhan, kinsay maapektuhan sa formalin ana. Okay, so don't worry. Again, that's for high nitrite ma-affected Japon ang ma-affected siya po ng mga enzymes na pwedeng, ang enzymes na ginagamit for detection of blood. Okay? Alright. And ascorbic acid na po, greater than 25 mg per dl, since because ascorbic acid is a strong reducing agent, and we use peroxidase biya in this test. So therefore, ma-cancel niya ang peroxidase, therefore, dili na noon ma-detect ang, or ma-test ang hemoglobin, or ma-detect ang chromogen. Because ma-cancel man sa ascorbic acid ang oxidase activity. Alright? And unmixed specimens, of course, that's why it's really important na before kang mag-chemical exam, imo jo i-mix. Because if gistandra ang urine for a long period of time, the cells settle at the bottom. Now, if dili mo na siya i-mix before nimo i-test, then therefore, dili siya ma-detect sa imong strip. Okay? Alright. Ayan. So this is what I was mentioning atong sa physical exam, na chemical test to determine between hemoglobin and myoglobin. This is your Blondheim's test. Now, what's the principle of Blondheim's test? It's precipitation. Muna yung principle. So, muad tag 2.8 grams of ammonium sulfate. Please take note. Ammonium sulfate atong reagent to 5 ml of centrifuged urine. Okay? So, Blondheim's test. Unsay principle? Precipitation. Unsay reagent? 2.8 grams of ammonium sulfate. Now, i-add natin na sila, and then you mix and stand for 5 minutes. Atong i-filter and then centrifuge. And then we test the supernatant for blood. Okay? Katurang pad sa blood. Because hemoglobin is, again, a big molecule, what happens, it combines with ammonium sulfate to produce a precipitate. Therefore, imong supernatant is, again, red precipitate. Clear imuhang supernatant. Why? Because, again, hemoglobin combines with ammonium sulfate. Understood? So, ma-precipitate siya appeal diri. So, your supernatant here, it's clear. Alright? Therefore, unsay result ana sa reaction sa strip? Reaction nimo sa strip is negative. Okay, kawala na hemoglobin, na precipitate naman with ammonium sulfate. Okay? Whereas, for myoglobin, since gamay man siya na molecule, dili siya makakombine with ammonium sulfate, the supernatant remains red. And your reagent strip also is, reagent reaction is still positive. Okay? So that's your Blondheim's test. Unsay reaction nato again? Reagent, you have your 2.8 grams of ammonium sulfate. Unsa ato ang positive reaction? Myoglobin is red supernatant pa rin, and negative is meaning red precipitate na hemoglobin ang naa. Alright? So clear na ang supernatant. Why? Because again, hemoglobin is a huge molecule, a large molecule. Ma-appeal siyang precipitate with ammonium sulfate. Okay? Alright. So that's for blood. Alright.